Hello, and thank you for tuning in to the latest edition of Small Bites with your host, Dr. Faithful Osawe. Enjoy the show.
Hi everyone, it's Faithful again from Dr. Osawe's Small Bites. I know it's been months, and I'm sure you've forgotten about me, or maybe you are just wondering what's going on with me. But you know what? I cannot believe it's the end of the year 2025. I know it's been a while waiting for all of us, as it's been for me. I'm sure a lot has happened, but I was just thinking as we were trying to roll on to the new year. I was thinking about something that I have seen a lot in my practice we can talk about to just remind ourselves about what things we should look into or look out for and lifestyle changes we can make to go into the new year. So I have seen a lot of coronary artery disease. I see that every single day in my practice with older folks, with young people, with even kids, people that are just in their teenage years. It may not be a large heart attack or big heart attack, but I am trying to figure out how to tell people more, or trying to enlighten people to know things to look out for and how to better take care of our health. More like preventive medicine, preventive cardiology. I want to focus more on that in my next talk. So today I will just talk more on coronary artery disease. I've spoken about it before in my podcast, but in this day I will try to highlight more things, trying to focus more on how we can look out for symptoms and practical lifestyle modifications that can help us in a healthy lifestyle to prevent it and to look out for it, and if we do have symptoms, to get that checked out. So coronary artery disease is a broad term for conditions that affect the heart and blood vessels, and commonly we see that these are caused by plaques that block arteries, that leads to heart attack, heart failure, strokes, and disease of the legs. We call that peripheral artery disease. I noticed that people know symptoms like, chest pain, yeah, maybe you're having a heart attack. They are very typical symptoms that we will see that makes even a layman know, oh wow, I'm having a heart attack. So like chest tightness, chest pressure, and chest discomfort, that we say, oh, that's angina. But there are other ways that heart attack could present, even if it's small or it's warning signs, like shortness of breath with activities. Maybe we were able to do more walking before and not feel short of breath, and all of a sudden you notice that you are walking a few distances or short distance, but you're short of breath. Another thing is exercise intolerance. Maybe you are able to play ping pong or play pickleball before and not feel short of breath. Now you feel like you do a little bit of that and you're huffing and puffing. Or the things you used to do before that you had fun doing, you cannot anymore because of exercise intolerance. Some people may have pain in the neck, pain in the jaw, in the upper back, in the upper belly. I've had cases of people that come to me and say, I just feel like my shoulder is heavy, and I used to carry my purse and I feel maybe my purse is making my shoulder heavy, and they get tested and they have a heart attack. So those are atypical ways people can present with heart attack. Fainting, loss of consciousness is another way to make sure that's not a heart attack. So the atypical symptoms can be seen that people may not pay attention or even register in their mind that is caused heart attack. Also, sudden fatigue. All of a sudden, people may feel, I'm so tired, more tired than I usually am. I wake up in the morning, I feel like I have not slept well, or during the day, I'm falling asleep a lot, or I just can't do anything. I just can't get myself to do stuff. Nausea, indigestion. People say, I'm having this heartburn. It could be GI issues, it could be the stomach, it could be other things going on, but we want to make sure it's not a heart attack. Dizziness, sudden back pain, isolated arm pain, sometimes even with aortic aneurysm, that's when we have rupture or disease in the aorta. The aorta is a large vessel, the largest vessel in the body, is a conduit that takes blood from the heart out to the body. If there is any disease there, rupture or dissection, it can also cause chest pain that can go to the back. So things like that, when we see symptoms or you know someone that has such symptoms, especially if it happens suddenly, you need to seek medical care right away. Now, why are these symptoms sometimes misleading? Because we kind of mistake them for just acid reflux, for stress, for muscle strain. People say, I'm just getting fat. I'm just getting, lazy. I feel like I'm lazy. I'm not doing much. So that's why I don't have so much energy, or I'm huffing and puffing when I just take a few steps. I'm not able to climb 2 flights of stairs anymore. All these things should make us think, is something going on, so that we don't get delayed recognition of a heart attack. So please, if you experience any of the symptoms, I really urge you to seek medical care. Talk to your primary care doctor, find a cardiologist, and get tests done. They can do an EKG where they put leads in your heart and look to make sure you're not having any issues with your heart. They do an echocardiogram, which is an ultrasound of your heart, to see the structure of your heart. Other things can be going on too. You could have valve disease, you could have high pressures in the heart failure, which may not even just be the muscle being weak. It could also be that you have high pressures in the heart. Sometimes lung disease can affect the heart. So if you do have the symptoms, not just heart attack, you can think about other things related to the heart or even the lungs. There are things that can cause chest pain or discomfort, like I mentioned, or even shortness of breath. Things like fainting or loss of consciousness, rhythm problems. So say people are having problems with palpitations, your heart racing more than usual. They feel like, I get up and I feel dizzy, lightheaded. So you want to rule out other things, even broken heart syndrome. What is that? It's a stress-induced heart muscle weakness that happens. People have stress, maybe they had something going on in their life stressful, that can really affect the heart and cause issues in the heart. As I mentioned before, aortic disease, PE, blood clot in the lungs, those things can cause chest pain, can cause shortness of breath, esophageal spasm when your esophagus is tight, or even when there's esophageal rupture, that can cause symptoms as though they're having a heart attack, or things like I mentioned before, costochondritis. What is that? It's inflammation in the muscle of or things around muscle or joints around the thorax. That can cause chest pain too. So there are many other things that can cause chest pain. Myocarditis. Myocarditis is a viral infection that affects the heart. Now there's a lot of viral infection, the flu, COVID, all that we have noticed. We've had patients that come into us with different symptoms, as I mentioned before, that could be due to viral infection in the heart. Pericarditis, so inflammation around the pericardium. The pericardium is a lining of the heart. So many of these things can be signs that something is going on in the heart. So if you do have any of the symptoms, please talk to your doctor so they can figure out what may be going on. Now, I want to talk a little bit about risk factors for heart disease or for heart issues in general now, not just heart attacks. People may have high cholesterol. So we focus on, you have different cholesterol, but what I want to focus on is the LDL. This is the cholesterol that can result in major cardiovascular events. And this is something that I like to tell my patients to look out for when they get lab work done. If your LDL is more than 100, then you should try to talk to your doctor about ways we can lower that, which I'll talk to you more about in a little bit. People that have very high risk factors. So what are those, or who are those people? Those that had a heart attack, peripheral artery disease, which is disease in the vessel of the legs. Disease in the neck is called carotid artery disease. Those that have diabetes, they're high risk for heart disease or heart troubles, or even a stroke. Those people, we want their LDL to be lower than 100. Typically, for these very high-risk factors, patients that have high-risk factors, we want their LDL to be less than 55. So when you go to your doctor, check with your doctor what your LDL is. And if it's lower than, more than 100, talk to your doctor. If you have significant risk factors, even a strong family history, you want your LDL to be lower than 100. Now, high blood pressure. Blood pressure issues run around in many families, in many people. High blood pressure is a risk factor for heart disease, for heart failure, for strokes, and all that. So I want to recommend that if your blood pressure is more than 130 over 80, the top number 130, the bottom number 80, if you have that high blood pressure, you want to work on that with high blood pressure medication, or even with lifestyle modification, your diet and things like that we'll talk about. Another risk factor is diabetes. Diabetes is a huge cause of heart disease and other heart problems. So I always say if you have diabetes, you want to be focused on that hemoglobin A1C. That tells us how your sugar has been in the last 3 months. You want your A1C to be less than 7. And actually, if you want to be strict, less than 6.5. So if you do have diabetes, please shoot for that number. And there are many ways we can try to lower our blood sugar. I will talk about that shortly. Obesity. If your BMI is greater than 25, you are obese. And you look at that, looking at your height and your weight. Those BMI above 25 tells us that you are higher risk for heart disease, and we need to work on that. Another big one is family history. Family history of heart disease is a very big cause or contributing factor. We call that non-modifiable risk factor. Meaning we can't do anything about that. Genetics. So people have the genetic predisposition to have increased risk for inflammation. Some ethnicities can increase risk for heart disease. Those that are from Southeast Asia, the Indians, the Asians, they are higher risk for heart disease. We're seeing that more and more. And in fact, we have a risk calculator that does take into account ethnicity. So that I've seen younger patients from ethnicities that are higher risk for heart disease with heart disease at a very young age. And talking about family history, if you have a family member who have heart disease, say for a man less than 55 or for a woman less than 65, your mom, your dad, your uncles, your aunties, or people that are your first degree relative, then you are higher risk for heart disease. I would recommend that you gather information from your family. Everyone, try to do that. Now the year is coming to an end. Why not sit with your parents, close uncles and aunt, and find out what are the risk factors that they have, what if history in your family, so that you can gather that and be able to discuss that with your doctor. For example, do they have high blood pressure? Do they have high cholesterol? Do they have diabetes, strokes, all that? Because when you do that, you can talk to your doctor. So that's the next step. You talk to your doctor, let them know the risk factors, because guess what? You can get screened. There's now screening tests we do. I already do all the time in my practice. We have the coronary artery calcium score, CT, very quick test, very cheap test. You can go get it done for less than even $60, $50 now. We do that if you don't have insurance. If you do not have insurance, you can give that to yourself so you can check your calcium score. And this advanced screening can go a long way to help you ensure that you do not have risk of heart disease, or you're not even having plaques in your arteries. And if you do, is it obstructing flow of blood? Because this changes a lot. If you do have blockages, then your doctor will have to let you know what the next steps will be. So I want to talk a little bit about healthy lifestyles, because I know we love our sweets, we love our ice cream, we love our carbs, our rice. I'm African, hey, I love my rice, I love eggs. Eggs is big for me, but I started to practice what I preach. So I eat less eggs now. I eat rice. I love rice. I used to eat rice almost every day. My family can tell you. But now I am in this lifestyle changes where I am trying to focus on what is healthy. Now, talk about diabetes. Let's go back to that for a second. We'll go back again to a healthy lifestyle. With diabetes, I talked about A1C that I wanted to be less than 7. There are medications that we know are very protective for the heart. We have these new kids on the block, okay? We have the SGLT2 inhibitors, like Jardiance and Farxiga. For those who have diabetes, talk to your doctor about those medications. We have the GLP-1 agonists that everyone is ranting about and talking about because they want to lose weight. So this is Ozempic and Mounjaro, and we are even having the Zepbound. All these medications are great for diabetics especially. And even we use it for patients that are not diabetic, who have heart disease or heart failure. So it's a very good medication for diabetics, especially because they lower your A1C, they help you lose weight, and they also protect your heart. So please, if you have diabetes, make sure you talk to your doctor about these medications. Now, going back to cholesterol, if you have LDL more than 100, your total cholesterol as well, if it's over 200, you need to talk to your doctor about ways you can lower your lipid levels. There's statins. I know there's a big talk about statins and how it affects the muscle and causes destruction of the muscle. People get muscle aches, muscle pain. Yes, but a lot of people tolerate it. And actually, it's a very good cheap medication to get your LDL lowered. Also, there are other medications that we get. Some medications are more expensive than others, like Repatha. Patients do take that and it's covered by insurance, especially if you cannot tolerate a statin. Those ones are 2-week shot. They're really, really good. I mean, I've had patients who've had LDL go from like 200 to like 50 or 55 in less than 3 months. So talk to your doctor about lipid lowering therapy. Fish oil and omega-3, those ones are helpful in some way, but they're not big on lowering the cholesterol if you have significantly elevated levels. And if you typically have heart disease, I would recommend that you are very aggressive on lowering your LDL. Your blood pressure, less than 130/80. Again, less than 130/80. If your blood pressure is higher than that, please talk to your doctor. There are good medications that can help you lower your blood pressure. I want to also talk about one thing that people don't pay attention to is their diet. Well, people say, you know what, it's a new year coming, I'm going to work on my diet. There are different ways to lose weight. Yes, people do intermittent fasting, but there are 2 kinds of diet that I vouch for because they have been studied over and over and has been shown to even decrease plaques in the arteries when they are taken consistently. One is the Mediterranean diet, and the other is the whole food plant-based diet. I will focus on Mediterranean diet today because it's easier to do. And the other one next podcast, or the next podcast I'll be doing, I'll chuck it in there somewhere. Now, the Mediterranean diet is high in legumes, the fish, the nuts, the extra virgin olive oil, the white meat, poultry, skin on when you eat, the poultry, of course, fruits and vegetables, and avoiding less of alcohol, less of cola, so the carbonated beverages, less of that, dairy, the red meat, the processed foods. So you may love to eat out. It's not a bad thing to eat out, but remember, most of the foods, they are high in all the stuff that are not good for us. So I would say, please try to stay away from those, the sweets, things high in carbs, so the rice, the bread, the potatoes, and all the stuff. These are things that are not healthy for us. If we want to really live a healthy lifestyle, we have to make changes. And unfortunately, it's not pleasant initially, but when we do that for 1 month, and you'll realize how better you would feel inside, and you will not even want to do those unhealthy diet. So we know that the risk of stroke, of heart attacks, and cardiovascular death is decreased with lifestyle changes, such as our diet change, such as trying to work on physical activity, increasing activity. Take the stairs. Do not take the lift all the time, the elevator. Try as much as possible to walk. Do at least 2,000 steps a day. Try as much as possible to stay active. Don't sit on the couch all the time. If your work is such that you work on the seat all the time, get up and move around. Find time to really focus, dedicate to your health. And trust me, whatever you give is what you get. I always tell my patients there's no way around it. There's no way. I cannot give you some way to do it. People say, oh, I want to take Ozempic so I can lose weight, but they don't want to do other work to try to eat right, trying to do exercising and physical activity. Well, they may lose the weight, but they're not going to keep it, and their health will not be as great as it should be. So please, a New Year's coming, we can do this. So I know that when we do this, we will feel better. We'll feel even emotionally and mentally better. Try as much as possible to share this. Please share and like, and at least 2 people. Like and share with at least 2 people, and I know that they will be blessed by it. I hope you have a wonderful, wonderful new year ahead. Know I love you guys. Blessings always. Take care.